Welcome to InfOT. Today we will explore the SMART goal setting in occupational therapy. Do you write SMART goals? SMART goals are widely used not only in occupational therapy but in other disciplinaries too. SMART is an acronym and can be found with quite a few variables. S stands for specific or significant. M is for measurable or meaningful. A is attainable, acceptable, achievable, and so on. R stands for relevant, rewarding, or realistic, and T is for time, time-bound, trackable, or time-based. Let's review each characteristic one by one. The goal needs to be specific for each client. What does the client want? Why does he or she want to achieve a specific goal? Is anyone else involved in this goal? Each goal needs to be clearly defined so that any third person could immediately understand it even without knowing specific details about the person involved. A goal should also be measurable. It should be clearly indicated. How will the therapist and the client know that the goal is achieved? How do you know when it's time to stop working towards this goal? Thirdly, this goal needs to be attainable. The therapist and the client should consider possible resources that would help achieve this goal or even the barriers. Is the environment, physical, social, or cultural helpful? Does the client have the skills or can work on skills to reach the goal? Goals should always be relevant to the client's life expectations and story. It needs to be meaningful and worthwhile for the client, the group, or the community. Lastly, goals are meant to be timed. When will you aim to accomplish the goal? Is there enough time? When and how will you start working towards the goal? Now, let's get more practical with some examples. In the first example, the client has suffered a stroke and now shows difficulty buttoning his shirts. A simple but not smart at all goal would be: client will button his shirt. But what kind of shirt? With how much help? This isn't specific at all. A smart goal, on the other hand, could look like this. By October 2021, client will once independently button all buttons on his favorite shirt in under 4 minutes. Let's take a closer look now. The goal is specific for the client and timed as well, with two different ways. It is related to the client and meaningful, and it can be measured and is attainable. In our second example, the client has poor finger isolation and movement, uses a dysfunctional grip to hold the pencil and gets tired too soon when writing. She wants to write on time in the classroom. A not so smart goal would look like this. Client will copy in a fast manner a sentence in her notebook. Now, how fast is fast? What kind of sentence will the client copy? Where will the writing take place? So many questions. A smart goal could answer all these questions. For example, by July 2021, client will independently write 5 sentences in less than 6 minutes in the classroom using a pencil grip 80% of the time. Again, the goal is well timed and can be easily measured. It is meaningful, attainable, and related to the client. There are quite many benefits when using a smart way to write your therapeutic goals. Just to mention a few. Therapists are more confident in goal setting when using SMART goals and enable improved transition of care. There is an improved goal attainment, and the patient satisfaction and functional outcomes are highly improved. Thank you for watching InfOT. If you like this video, feel free to like and subscribe. Stay tuned for more.